So other things we do here, this is neurotherapy. This is a way of supporting the brain, helping the brain with like anxiety, depression. Those are common things that we can help with, amongst other things, without necessarily giving a medication. So it's biofeedback. We can see how the brainwave activities are within the brain in different areas of the brain, and then help retrain the brain to go back to a more normal pattern. It's a non-invasive procedure used over the last 30 years with dramatic results for a multitude of symptoms and disorders: ADD, ADHD, anxiety, panic attacks, depression, insomnia, migraines, autism, learning disorders, post-traumatic stress, performance anxiety, and a lot more. Neurotherapy can include a quantitative EEG, brain mapping. That's when they actually hook you up to 19 leads all around the head. It's not painful. It's held on by these little, like, goopy, like what they use in ultrasound. And then they're able to see the brainwave activity throughout the brain in different areas. EEG biofeedback, PEMF biofeedback, combined with light, sound, breath, and educational therapies. So with the kids, I've seen where they use those lights, those photic lights, or they can play these video games. It's like a car on the road. And if the car goes off the road, then their brain waves are not in a positive line. So then they learn how to put their car on the road, and it's kind of like learning how to play an instrument. So that's why it's a couple, several visits so that they can learn, and eventually the brain will just kind of sustain that pattern. 19 electrodes connected to the head with a computer to identify abnormal brain waves associated with various symptoms or disorders. A program specific to the individual is then developed to train the brain to self-regulate abnormally fast or slow brainwave patterns in specific regions of the brain. Recently, the FDA approved a device that's very similar to the one we actually use in this office to diagnose and treat ADHD.